Good afternoon to you all. Good afternoon to you all. We know this is right after lunch, so I know some of us are feeling a bit heavy, but want to start with proceedings now. I would like to welcome you to the ISSER Conference Hall. For our partners from Cornell, this is one of our meeting or conference facilities at the university. We are being hosted by the Institute for Statistical, Social and Economic Research. This is part of their facility, and I would like to thank them very much. Today we continue the enlightening discussions we started yesterday. We look at some of the world's most topical issues. Our first panel would be looking at public health and policy. And I wouldn't want to waste a lot of time, so I'll go ahead.
I'm really honored to have listened to all of the words yesterday and some more discussion in the evening to talk about the many issues that we need to address. There's so much that as a collective community we need to get done, so many issues to be addressed, and so many problems to solve for our children and grandchildren. And remarkably, these problems are not unique to our own hometowns, countries, villages. They are common problems with perhaps different variables to contend with. We heard yesterday about the way we can address these problems more effectively if we work together, and we saw and felt a strong will across both of our institutions to do so. Today, we'll talk about some of the key issues that we can tackle together, issues that face all of us, and issues that can only be solved with interdisciplinary approaches and novel partnerships. So in this panel, we'll be discussing public health as defined from a One Health perspective, a perspective that is very close to Cornell's heart and that touches many of the colleges and campuses of Cornell University. And now, as we've learned in the past few days, it's also a perspective shared by our friends and colleagues here at the University of Ghana. At Cornell, we're relatively recent in the evolution of our rounded public health program, although all the ingredients have been in place for many years. So to begin to organize, we've developed several programs that have brought together these individuals from across our community. About 5 years ago, we initiated a Masters in Public Health program, starting in the Veterinary College, my college, and the college of several of my colleagues here today, and very much reaching out to, throughout all the colleges of Cornell. So our MPH program was founded because we recognized that the most pressing health challenges facing humanity essentially boil down to two issues. Firstly, the unsustainable ways with which we interact with the environment, which leads to things like climate change and the emergence of novel pathogens such as Ebola and SARS-CoV-2. And secondly, the inequitable ways that we interact with one another. We also recognize that to train the public health leaders of the future, we need to not just teach them in the classroom. We need to have students working in small groups with leaders and thought leaders from around the world to work on real-world problems from New York and across the globe. For these reasons, Cornell's MPH program is unique amongst schools and institutions in the US in that it focuses on pillars of sustainability, equity, and engagement. All of our MPH students learn a One Health Systems approach so that they can understand the connections between human health, the living components of our environment, animals and plants, and the abiotic components of our environment, air, water, and climate. One Health is drawn as a triangle or three overlapping circles to emphasize that anything that affects the health of any one of these can impact severely the health and sustainability of the others. But how we interact with the environment doesn't happen in a vacuum. There are many social, cultural, religious, political, and economic forces that shape human behavior and shape the health and well-being of animals and humans alike. And this is where public policy also comes into play. So on top of our new MPH program, around 2.5 years ago, we opened the Brooks School of Public Policy to harness the university's wide-ranging expertise in public policy teaching, research, and engagement, with expertise in every region of the world. to apply a global, interdisciplinary and solution-oriented focus to a broad set of public policy issues. Building upon existing and developing academic strengths at Cornell, the school's core areas of focus include data science and technology policy, environmental and sustainability policy, health policy, human security, the politics and economics of development, race, racism and public policy, and social policy and inequality. And then the third component of our public health focus is the new department within my College of Veterinary Medicine, but again spanning the colleges, and this is the Department of Public and Ecosystem Health, or PEH as we call it. PEH is different in structure to most departments. Instead of being an approach-driven or topic-driven department, it brings together different professions and disciplines to work around tackling the world's most pressing challenges around health food systems, encompassing everything from food production and consumption and associated nutritional and health impacts, emerging health threats, which grapples topics such as novel infectious diseases, antimicrobial resistance, and climate change. And finally, biodiversity conservation, which is needed to preserve the systems on which all life depends. And lastly, our fourth component includes our collaboration between social scientists and public policy researchers in Ithaca, our main campus, and the strength of our clinical and translational researchers at Weill Cornell Medicine, which is our medical school based a few hundred miles away in New York City. New York City, of course, is a city that represents almost all ethnic groups that you can think of across all bands of the socioeconomic spectrum. Access to these communities, along with the more rural communities in and around Ithaca, provide us with unprecedented access to people from all walks of life, dealing with the challenges and threats we face in One Health from very different vantage points. These communities are a kind of bellwether, giving us insight into how differences in resource availability, healthcare access, genetics, history, and culture can affect health, well-being, and quality of life. Let me stress that each of these constituent parts of each enterprise were already here within Cornell. We just needed to organize these units. And having not done so, I now believe that we're ready and eager to tackle these problems in partnership with other institutions thinking along similar lines. We realize that the extent of the problems being faced cannot be fully comprehended from our little perch in a small town in upstate New York, nor can the enormity of the challenges we face across the globe be tackled by just one arsenal of tools. We need the collective expertise, energy, knowledge, and determinations of our partners here at UG and indeed across the world. So with all this in mind, I'm really happy to present to you this panel today, focusing on diverse approaches to public health, envisaged broadly, from zoonotic disease and emerging pandemics to mental health, to new technologies for distributed diagnostics, including the application of AI, facial recognition, and smart technologies for improving well-being at multiple geographic scales and in different socioeconomic contexts. So if I could ask our esteemed panelists to come up to the stage. As they do so, I will attempt to pronounce their names properly and introduce them as they come. Firstly, we have Professor Kwasi Torpe, who is the Dean of the School of Public Health. Next, we have Dr. Genevieve Ayite, did I say it right? Senior Lecturer, Department of Health Policy and Planning and Management in the School of Public Health. Next, we have Professor Alex Nading, who's an Associate Professor of Department of Anthropology at Cornell University. Do we have Dr. Delanai? Oh, yes, she's there, right there. Dr. Delanai, Acting Guyana Country Representative of the Population Council. And last but not least, I'll say Boateng, who's the founder of AKB Hope Foundation. And he gets a second round of applause because he's a Cornell alum. So welcome. I'm going to ask you each to maybe give a little bit more of an introduction of who you are and why you're sitting here, alongside your remarks on this very important area. So, you give advice.
Thank you very much, Professor Cohen, and welcome to this engaging session. What we have decided from the School of Public Health is basically to look at universal health coverage from different angles. We are all aware that the wealth of a nation depends on the health of the population. And we would, if we can start the slides, we would want to look at universal health coverage. I would look at it from the primary healthcare perspective and then the network of practice. And then my colleague Genevieve will talk about it within the context of national health insurance. And in terms of the introduction, like that, I'm Keate. I'm Dean of the School of Public Health. I'm a professor of family health and also a public health physician. Good. Okay. So the route to the universal health coverage, the network of practice, and I will explain what the network of practice is. Next slide. Next slide. Okay. Now, if you look at Ghana's vision for universal health coverage, I mean, the idea is for every Ghanaian to have access to health services regardless of the ability to pay. That is our vision. And I believe that if we are able to attain this vision, then we'll be able to tap into the individual capacities that we have in this country. Next slide. Now, in terms of the health system in Ghana, it's organized by different levels. And at the base, you have the community level, and then we have the sub-districts. And then from the sub-district, you move to the district hospital. And then we have the regional hospital. So each of the regions, you may have a regional hospital. And then finally, we have the tertiary facilities that serve as the teaching hospitals. Now, the Ghana Health Service actually manages the health facilities all the way up to the regional level, while the Ministry of Health takes care of the tertiary facilities. Now, I must say, when we say primary health care is care up to the district level. So, and this is important because if you look at the population that we have, 80% of them actually access these facilities. So it's really important that that should be the thrust of our road to universal health coverage. Now, we also know that the gatekeeping role of the primary health care is suboptimal. So we have people moving from the community, then they go all the way up to sometimes a secondary or a tertiary facility. But if the gatekeeping rule is working very well, then you expect them to be screened and then sent to appropriate facility within the district health setup. All right, so now what is our approach to universal health coverage within the context of the primary health care? So the Ministry of Health, Ghana Health Service has developed what we call the network of practice. Now, what is the network of practice? The network of practice basically looks at the architecture of the primary health care. So I mentioned earlier that is the primary, the community, the sub-district, and then the district. Now, the network of practice looks to identify model health centers at the sub-district level. So with the model health centers at the sub-district level, then they will try and provide services to most of the population. I mean, when we do that, you get these benefits. One, the quality of the service is likely to be better, the timeliness because it's closer to the community, and then also it reduces costs. So this is the model that the government has been working on the last 2-3 years. And we at the School of Public Health actually have been engaged in some of the work. So the Model Health Center, we expect it to be adequately resourced, because there's no point having a Model Health Center which is not adequately resourced. So it must be adequately resourced. It must meet the provision of the essential health services within the country, and then also it must be in the sub-district level. So this is the architecture of the network of practice. So the center of the network of practice is the sub-district level. Now the issue is the policy. What is the policy arrangement to enable us implement the network of practice with fidelity? And this is something that we'll probably discuss more when we get into the discussion segment. And we've been engaged in some work with the World Bank and other partners on how to actually improve the network of practice. So like I said, if you look at the people going to the health facilities, the top three: malaria, upper respiratory tract infection, and then diarrheal diseases actually account for 40% of morbidity in this country. So clearly, the network of practice has an important role. And I think we as public health people really need to look how we can implement these interventions with fidelity to be able to achieve the desired outcomes. And thank you very much.
Good afternoon. So I'm Genevieve Keate with the Department of Health Policy Planning and Management. My research interest is into health policy and health economics. So following up from where Prof. Tope ended, I'm going to look at primary health care in terms of how Ghana has come so far with regard to the use of the national health insurance as a major policy to reaching universal health coverage. So I will not repeat this, but as Prof mentioned, the decision-making process in Ghana is basically from the top to the bottom. So policies are made at the top and implemented at the bottom. So we have the MOH at the top, and then the Ministry of Health, which is the MOH, and then the Ghana Health Service is the implementing arm of the Ministry of Health. And then we have the private providers also playing significant role in provision of health services, and also the government facilities as well. And again, development partners also play important roles, specifically in terms of capacity building and providing funds for implementation of various health services in the country. So primary health care basically is to make sure that every individual, irrespective of who you are or your socioeconomic status, you have access to quality health services when you need them without any limitations in terms of financing. And the good old primary health care box is, as you can see, where we ensure that for any policy at all that you implement, you have to consider the people, how many people you are able to reach, what type of services you are able to provide, and then at what cost. So whatever policy a country is implementing, if you want to reach UAC or universal health coverage, you have to make sure that you attain these three different arms. And if you look at Ghana, basically how we have evolved in reaching universal health coverage, prior to independence and immediately after independence, services were basically free. Everybody can access services. But then during the economic recovery programs in the early 1985s, it's required that there has to be some cost containment, and therefore people must pay for the services that they receive at the health facility. So it became the popular cash and carry system that we had. And the challenges of the cash and carry system required that people must look for options. So there was a community-based health insurance scheme and all other schemes. Most of them did not really provide the answers that we needed. So with time, then out of a political interest, there was the introduction of the National Health Insurance Scheme in 2003. And the National Health Insurance Scheme basically was to reduce this financial access to health services. And it has three main arms. You have the scheme, which is the main purchaser of health services, and then we have the providers, and then we have the clients. So these three arms work together to ensure that every individual is not limited financially to access health service. The scheme has evolved over time, and this is what I want us to know, and I want us to look at what the policies that the scheme has carried out in order to reach UHC. First of all is the promulgation of the law. After that, there were the implementation of membership registration, and then also biometric registration. After that, the scheme also looked at policies that included e-processing of claims. They moved from the paper processing of claims to e-processing of claims. And then also the law was actually revised, so Act 650 became Act 852 to consider all the challenges that came up later on. And then the major activity that came on is the renewal, which was more of using you can use your phone to renew, so you don't need to go to the health facility to stay longer hours to be able to renew. So those were major, policy changes that came up in the NHIS. Apart from that also, they also implemented the biometric registration card, which meant that whatever card you have, you can also use it. Currently they are trying to merge if you have your Ghana card and then your NHIS card to make life actually easy for you. And then also they opened up the call centers where you can address your grievances, etc., etc. So these are all major policies that aim to improve service provision or the health insurance scheme to make sure that we are able to achieve UHC. So 20 years on, what has happened in terms of enrollments onto the scheme? Because once you are enrolling, we can see that so long as there are many people who are covered on the scheme, we know that we are reaching UHC. So over time, between 2009, the data I have now, until 2022, enrollment is about 45%, thereabouts. And then renewals are also up based on because of the use of your phones to be able to make renewals. And regionally, in terms of regional, enrollments, I brought this up because there seem to be some disparities. Some regions are doing well in terms of uptake for the enrollment, while other regions are not doing so well. So it shows that there are some inequalities in enrollments in the scheme. WHO and the World Bank developed an index to look at how we are doing in terms of how countries are doing in reaching universal health coverage. And it's part of the SDG goal 3.8.1 and 2. So they use it to estimate the coverage index for every country. And as at now, Ghana, the range of the coverage is between 0 and 100%. 0 means you are not performing well, 100 means you are doing well. And as at now, Ghana is at around 47%, so we can say we are in the middle. So I leave 47% for you to interpret. So that's where we are now. We are at about 47% in terms of UHC. So basically, in conclusion, what we have seen in terms of Ghana's progress towards UHC is that while we are doing well, there seems to be some disparities or inequalities in terms of enrollment. And this is because with COVID-19, it limited countries' abilities because now policy focus shifted to look at COVID other than, reaching out to people for the basic health needs. So that also provided a challenge. So the recommendation is that we should go back to the primary healthcare model, and then we should be able to look at what we can do to improve on how access to quality health services. And one of the ways of doing that now, as Prof. Tope has indicated, is through the network of practice model, which is more of reaching out to them at the community level. Thank you very much.
Well, good afternoon. And I want to thank everyone who made this event happen for having me along. And I should introduce myself again. I don't have a PowerPoint. My name's Alec Nading, and I'm trained as a medical anthropologist. And I'm not an expert on Ghana. or on West Africa, and I have not yet really been involved in either public policy or public health at Cornell. So I'm playing the classic role of the anthropologist, which is the funny-looking outsider, and so I appreciate having the chance to do that. So nearly all my research has taken place on community health in Latin America, and a lot of it's up to now has had to do with mosquito-borne disease control and community health. So what I'm going to talk about is a bit of a reflection, partly on that and partly on what I see as anthropology's role in building good collaborations. So I think of myself and my research is oriented towards what I meant. So global health as we know it wouldn't exist without those drugs, but it certainly wouldn't exist without the work of the Treatment Access Campaign. And that story, unfortunately, I think still needs to be retold, lest we, the powerful, the governments, the universities, start telling ourselves that we already had it right, that we've been doing the right thing all along, right? Lest that we think that the power is in the technology and not in the relationships. So in the early days of the Ebola crisis, Paul Farmer put this another way. He said that the failure was not necessarily just a viral pathogen, but a failure of the relationship between what he called stuff, staff, and systems. So the point there was that a vaccine or a medication or another high-tech solution isn't a solution to anything without people who are trained and available locally at that sub-district level, right, to use them. So health, not just about investing in technology, and it's not just in training, but it's in social infrastructure, the tissue that connects technology and training. And this is what a lot of my research has been about, and what I hope to continue doing through collaboration with partners here at the University of Ghana. Because I think collaboration is public health's greatest technology. But we often sometimes think of collaboration as the first step towards developing a technology, a precursor rather than a technology itself. So as I said earlier, I get these ideas partly from a lot of my research working and studying the lives of community health workers, the people that are working at that most local level of health systems. And these are the people who do the difficult and thoroughly underappreciated work of bringing life-saving medicine to people and taking steps to prevent diseases before they happen, helping to control the spread of mosquitoes that transmit dengue and malaria, which is my personal interest. So these people don't have fancy degrees, they don't get paid nearly enough, and yet it's really impossible to imagine public health without them. And just to give you a sense of how important these programs are, I did research in Nicaragua long after the heyday of the Nicaraguan Revolution, when the public health and community health system was really built. And many people would have said it was deteriorating, but the thing that really was lasting was the spirit and the energy of community health workers and their willingness to take part in continuing to do that knowledge transfer and delivery, right? So what remains challenging is getting the support for these workers, right? And so what I've tried to do in my work is to make the case for the importance of the work that they do, how they communicate, and what effect their presence or absence in the community might have. And I've tried to illustrate that health outcomes are best achieved when these frontline workers aren't just one-way deliverers, but two-way conduits, right? Bringing knowledge from communities back to those higher levels of the system that we heard about earlier. So in my latest research, I'm trying to rethink public health through a very old technology of care and security and collaboration, and that is housing. So on Tuesday, I met with a group of colleagues from across the University of Ghana and learned what a complex and challenging issue the provision of safe, comfortable housing is here. And in the context of climate change, access to safe housing is going to become even more critical for at least 3 reasons, and this is what I'll close with. First, what I learned is that people are migrating to cities like Accra, seeking new opportunities as farms and fisheries start to fail due to drought and global warming and pollution. So the population of the world is on the move, and we need to figure out a way to see that that population remains safely housed. And second, housing is here and elsewhere a prime site of climate vulnerability. So we learned this during lockdown, right? People are increasingly unsafe in their homes due to a lack of clean water and air, continued risk of exposure to mosquitoes, and most of all due to dangerously high temperatures. So in our project, we're asking how communities work together to build safe housing, looking at the ways that they share materials and resources as well as ideas for improving ventilation, regulating temperature, and accessing water. And so we have strong reason to believe that some of the best ideas for doing this actually come from householders and communities themselves.
2.
And so most of the work that we've done, or what we're known for, is rigorous research in the fields of sexual and reproductive health, family planning, education, and the like. And so when I was given this opportunity to speak, I thought this would be a good opportunity to pivot and to, because of, in the spirit of collaboration, think of presenting another aspect of the work that the Population Council does at a global level, and then see how it's applicable to Ghana, and then plug myself and my organization into what's happening. And I think we've said a few things today that have already started piquing my interest. Because I'm going to present to you on an initiative and a center that we have at Population Council. But before I start, I just want to say thank you to the Cornell University for giving me the opportunity to speak. But also, I have waited 21 years for this opportunity to happen, because I have two colleagues two people that I consider friends who are also colleagues, but have never had the chance to interact with them on a professional level. So 21 years ago, we met at Cornell University, and today we're here, we're gonna have a conversation. So I'm very excited about that. They'll introduce themselves later, but I just wanna thank Cornell for this opportunity for this full circle. And also that I have another colleague from my department at Cornell University, and so it just feels very much of a full circle moment. Thank you. So, like I said, I wanted to present today on the Population, Environment, Risk, and Climate Crisis Initiative that we call PERC at the Population Council. So thank you for the opportunity to do that. Next slide. Or am I doing the slide? Okay. How does it? Oh, thank you. So it's working. Thank you. So PERC is part of the Population Council, which I've explained is a global nonprofit with an exceptional track record in practical interventions that improves lives around the world. So the areas that we work in include providing more reproductive health or reproductive choices for all people, equipping communities to adapt to the climate crisis, and ensuring that young people lead full lives and productive lives. So our research leads to better policies, programs, and technologies. So just to say that we have 4 main strategic goals, but the one that I'm going to focus on today is on climate justice. We also have a couple of centers and innovation hubs focused on adolescents. It's called Adolescent Girls, the Girls Center. Others are on biomedical research, humanitarian task force, gender and education, and then family planning. We're located in 14, we have 14 offices across the world, but we do work anywhere and everywhere. So we consider ourselves globally, locally led and globally connected. So, talking about the gaps, the evidence gaps that are an issue that we need to consider as climate change or the climate crisis accelerates. Like I said, we've had a few discussions here and there or points that have been raised, but I just want to say that with regard to what's happening at the global level in terms of mitigation and reducing greenhouse gas emissions, those are critical, but I'm not going to stop climate change from already posing what we consider an existential threat to to millions of people. That's why we feel that we need to address adaptation, working with people and communities, as Prof. Nadine talked about, to effectively adjust behaviors and systems to cope with climate change. Climate financing has been disproportionately tipped towards mitigation, But with a recent goal of 50-50 funding, we see a new and growing focus on adaptation, and after COP28, growing work around climate and health. So while there are a number of studies that are showing that climate is affecting health, which I'm sure we'll hear in the next panel, gender dynamics as well, livelihoods and economic potential, shifting youth transitions to adulthood by causing school dropout and child marriage, evident gaps remains. So now, not just that how the climate will shape what we know in terms of development outcomes, but also what the effective solutions are or will be. So we agree that more research and programming is necessary, but also approaches seem to be siloed. And the anthropologists are doing what they need to do, the scientists, the livelihood scientists are doing what they need to do, the social scientists are doing what they need to do. But I really believe that we must dismantle this fragmented way of looking at things and think of more collaborative ways and cohesive ways. And that's why I thought it was important to present today. So the council is working on these initiatives, and PERC is one of them, and it seeks to fill the gaps. So I want to present now on some of our innovative research achievements and our plans for growth, expansion, and impact. And like I said, I hope this is maybe helping some of you think about the work that you're doing in ways in which we can collaborate. So, PERC conducts rigorous research in collaboration with teams and communities on the ground. We do innovation of health research to define the biological mechanisms and pathways between climate hazards and health outcomes to design more effective interventions. We design rigorous youth co-led climate research to develop formal and informal education curricula that help adolescents, especially girls, develop life skills to thrive in the emerging green economies and societies that are being reshaped by climate change. We also deliver population data sets and predictive models to identify climate risk hotspots and ensure equitable progress on climate adaptation with a focus on urban settings. REACH is one of the projects that I would like to maybe discuss here and tell you a little bit about while I talk about others as well. So here, almost half of the world is exposed to extreme heat. Exposure to extreme heat increases mortality, morbidity, adverse pregnancy outcomes, and negatively affects mental health. We will need to learn more about how to adapt with this, as 2023 was the hottest year on record and projections are grim. Our work on heat is also exploring how heat waves affect vulnerable age groups, including the elderly, and the risks that heat and air pollution pose to dementia and mental health, and also working with pregnant women and newborns who are highly affected. Our work includes a gender lens, for example, how heat waves may increase care burdens that are placed on women to care for children and elderly household members. And lastly, we build on existing research with the health workforce, including midwives and traditional birth assistants and attendants and others who are basically frontline workers who are providing services during these heat waves. So that's one aspect. There's also the salinity. There's also a project on salinity risks, which we have in Bangladesh, and I'm happy to talk about that later. With regard to the Green Project, climate will have many impacts on young people's lives, disproportionately harming young women and girls. Climate change reinforces harmful gender norms and threatens progress on gender equality. There are documented increases in school dropout, in child marriage, as well as gender-based violence. So we can work through formal schools to increase climate literacy and teach new skills. But as climate increases rates of dropout, we also need to leverage council design platforms to reach out-of-school girls, because as I told you, we also work on do a lot of work on adolescent girls. So an estimated 129 million girls are out of school due to climate issues. There's also the Impacts Project. Essentially, it's a demographic modeling approach that projects future population dynamics at 5 spatial scales, I think 5 different levels of spatial scales. So I just want to highlight here the partners that we've been working with, but obviously one day I hope to see, thanks to the collaboration we're going to be having, UG would be here, Cornell University will be here as well in terms of our partners that we can work with. Just another plug-in for the Population Council in terms of the different work that we do, being a one-stop shop for data and insights. I know there are some students here as well. In terms of the Girl Center, PERC, EAGER, which is on education, as well as the Gender Power Metrics database. So this is what I just wanted to have the opportunity to present about and to open up doors for collaboration, open up doors for discussions while we think about this major issue of climate change as we face, I didn't realize 2023 was the hottest year on record. I would say 2024 is doing a pretty good job right now. But there's a lot to be said about the collaboration that we can come together to solve or try and deal with these issues, because climate change is very, very, very keen and then sort of transcends into our lives, and is also an aspect that needs to be taken. It affects almost everyone. And so I hope this has been a short journey. I've taken you on a short journey of the work that we do at the Population Council, and look forward to collaborations. Thank you.
Hello, everyone. Thank you all for being here, and thank you so much to the leadership of Cornell and University of Ghana for giving me this opportunity to present on the work that we are doing at OKB Hope Foundation. So this is the slides ready. Okay, cool. So OKB Hope Foundation is a nonprofit organization that is focused on bringing healthcare to the doorsteps of rural and underserved communities. So we do a lot of grassroots work where we go to these communities at their doorsteps to provide healthcare for them. So our vision is to offer transformative health services and life-saving medical supplies right at the doorsteps of these communities. So through the work that we've been doing and through our market research, we saw that a lot of people still in the rural and underserved communities still have to travel several miles to the nearest hospital or the nearest health center for their healthcare needs. And once you get there and you talk with them, you realize that most of the disease that they present are disease that could have been easily prevented or easily managed if they are screened early, or if they have been provided with some sort of health education. And so that was one thing that we found. And the other one was like, even if you find that one other factor that plays is transportation, how can they get there, or even the funds for them to pay, for their healthcare services. So most of them wouldn't even go, even if you go there and provide them the service and you want them to go for a follow-up, because transportation alone is a huge barrier. So the work that we are doing is to really bring this healthcare right at their doorstep. So we do that using a mobile medical unit, which offers pretty much a doctor's office on wheels, where we are able to offer consultation, lab diagnostics, medications. And so we work with the district health directorates and also some of the local health centers and the CHIPS compounds in their communities to identify communities where there are no health facilities, communities where individuals have to travel several miles to the nearest hospital. And once those communities are identified, we then go there with our mobile health unit, where we go with doctors, nurses, lab technicians, pharmacists, and provide them with primary health care as well. And also, if the condition that we meet there exceeds what we can provide in the van, we are able to also refer them to the local centers due to the relationship that we also build with them. So since we launched in February 2022, and today happens to be the second year since we started with this project, we've been to over 55 rural communities, serving over 6,000 individuals across these communities. And sometimes too, we work with religious organizations and the corporations to be able to provide medical care to their church members and also to their employees. Apart from what we do, we realize that sustainability is key, and to do that, it's very important that we involve community members in that. And so what we did, knowing that some of the travels are far, sometimes we go as 3 hours away from the city to these communities, and knowing that, we started training some of these community members. And we didn't only train them, but we also give them the resources to be able to do the work that we train them to do. So here we started this project in 2022, where we trained over 20 community members across 4 rural communities. And then they were able to at least check the blood pressure, so we give them the blood pressure machines, and what they would do is to do a follow-up care for individuals that we go to the community and identify that they have high blood pressure but they don't have the machine. We give them the instruments where these people are doing the follow-up care for us, and we go to these communities on a bi-weekly basis to collect the data to identify individuals that need additional care and then provide the care to them. Also, we realize that we cannot treat physical health and leave mental health, because physical health and mental health are closely interrelated to each other. So what we started also through our Wuhunhiami Wellness, Wuhunhiami means I care for you. So it's a local language in Twi, which means I care for you in English. And the whole idea is that how do we bring mental health care to the doorsteps of the youth, to the doorsteps of the individuals that need it the most. So we started with our Wuhunhiami Wellness, which is focused on bringing mental health to the doorsteps of the youth. And since we started that, we've been to over 6 high schools, educating them on mental health and providing them with mental health resources. And as part of that, our goal is to now establish wellness clubs in these schools, which will provide them with consistent support as well. So I love the idea of collaboration, and through my work, I've been working a lot with some institutes at Cornell, like the Institute of African Development, that has been really supportive of the work that we are doing. So as part for what we do, we organize global case competition where we invite students across the globe. So from US, UK, Ghana, Canada, we give them a healthcare challenge, and then they would come together, work together, develop innovative solutions to address that. And so last year we did one to address mental health accessibility, and the ideas that the student brought forth was one that I just mentioned with the Wellness Club, and also a telepsychiatry consultation, which currently we are also working with a student club at Cornell called Cornell Hack for Impact, where we are developing a telepsychiatry consultation platform, which the goal is that we don't want to go tell these students that you have a mental health issue, but also to provide them with the resources and the solution to address that. And as part of that too, I also host students as well, Cornell students for the most part, who come to Ghana to really volunteer with us, get to learn the work that we are doing in the rural community, so pretty much different from what they experience in the US, and really have received strong support from the Institute of African Development to really make this happen. As part of that, we also work with a SMART research program at the Dyson School as well, where this past month, January, we hosted about 10 Cornell students and a professor, and we worked closely with the Dean of Medical School, Dr. Yeltsin, to really do some research around the role of religious leaders in assessing primary healthcare in rural communities, because once you get there in the grassroots, religion play a very key role in whether someone accesses healthcare or not. So really also addressing that from the religious perspective. We also do organize educational sections with experts, and this is Dr. Joseph, who does a lot of work on mental health accessibility when it comes to religious leaders. And so for our next steps, our goal is to definitely cover more rural communities, expand our work beyond the southern border and go more to the north, establish the wellness clubs in these high schools to be able to provide them with consistent support when it comes to mental health, and also how can we leverage technology to be able to provide some sort of virtual care. And I was glad when Dr. was talking about the network of practice, which I believe that it will be very key in making sure that everyone have access to quality and timely health care. So thank you for your time.
So thank you to each of you for your unique perspectives, a really huge range of issues, and apologies to Della. She's also a Cornell alum, so sorry, I forgot. I'm going to start the discussion. I'm not going to spend too much time on my own questions because I really want time for the people in the audience to ask questions. But just to combine two of the questions that you may have received before, and there are some microphones around. There are two questions. Where will technology have the most impact in improving these issues that you've raised? And what do Ghana and the US need to do to promote the development and uptake of new technologies? And then the flip side is technology can only take us so far. So what non-technology resources do we need, and innovations do we need, and how can we work together to provide those non-technology resources as well? So please take a stab at that one.
Hello?
It's okay. Thank you very much. In terms of technology, if you look at the primary healthcare program, and you look at the constraints that we face in the health system here in Ghana, we basically need technology to make that leap. The major constraint we face is human resource. There are other health system challenges, but human resource is huge. And currently, the Ghana Health Service Ministry of Health is basically trying to take advantage of telemedicine. Because you see, if you set up these networks of practice, we need to have people who are there. Now, and we've done some work to show that people go to these facilities, they don't have adequate staff, they do not have their medications, then they bypass the facilities close to them and travel many kilometers to go to the district hospital or the regional hospital. So with these teleconsultation centers, which is currently available in a number of regions, these health centers can actually seek support from the higher level. And in so doing, they are able to give the care that is required, and then also, if they have to refer, and this is a country where sometimes they will refer you, you go to one hospital, so there is no bed, you have to move to the next one. So the consultation centers, the teleconsultation centers could also direct you where to go and then get the needed care. Now, in terms of technology, you put the technology in there, you need to maintain. And of course, already we've started having challenges when there is a breakdown. Who fixes it? Who buys the data bundle? You understand? So the technology in itself would help you, But you also need to make sure that the solution that you have put in place is sustainable. There is a system to be able to provide resources for you to keep all the things that you have. So I think technology is really, really going to play a big role as we expand access to services. And I remember many years ago, this is from another African country that I worked in, where in the health center, they could actually screen for cervical cancer. The nurses would do it, and then if they have any issue, they have a feed to the tertiary facility, and then the doctor and the teacher will just look on the screen and then see what the problem is, and then say, this is it. This is the intervention that you have to put in place. So technology really has a big role, and I hope that we'll be able to tap into the opportunities available for us as a country. Thank you.
Yeah. My thinking on technology is how to leverage what the Ghanaian understands as technology and appreciates. For example, if you look at the use of social media, that's a major route that every Ghanaian, everybody has WhatsApp or Instagram or those. So if we want to leverage on technology, we perhaps need to look at those areas that's more attractive to the Ghanaian than you do. There is an app, you have to go somewhere, which is not so familiar with them than you do something, you've created a page on Instagram or anywhere that people can easily access. Now people have live shows or something on TikTok, whatever, that they know that you can go there and listen. So make it more attractive, more lively. That's what the Ghanaian, or I have to say the African, if you look at the direction of technology, we have taken up the WhatsApp, the TikTok, the YouTube, the Facebook aspect of technology. So we should be able to leverage on those areas. That's where I see that uptake is likely to be. Then gradually, once we start expanding our understanding or our appreciation of technology, then the other bigger, more complex ones could. And then, as Prof said, you have to think about sustainability. So if this technology could be something that will not require you to use your data, it's a short code, you go there, you do whatever it is, and it doesn't come at a cost, then we can make use of it. That's my take.
I'm not a developer of technology, but what I just want to sort of reflect on what I've heard here first, which is that, we often talk about diseases being communicable, but health is communicable too, right? So I absolutely agree that WhatsApp has changed how health communications is working. I see that in my research in Nicaragua as that technology has come on board. Mostly for good. We all know, and we heard last night, the way that could be for bad. But I guess for me, one of the things that I think is really exciting as an opportunity about working under conditions of irreversible planetary change is that it causes us to imagine technology differently. And the example that I'll think of is from the mosquito-borne disease control world. For decades there have been innovations, some of them successful for quite some time, over different periods of time, in chemical prophylaxis for mosquitoes, mosquito nets, aerial repellents that sort of move with people, curtains, and of course going all the way back to the larger scale era of things like DDT. But what I'm really excited about is the ways in which we're trying to think of non-chemical architectural ways to manage the inevitable relationship that's going to exist between human beings and mosquitoes, right? So rather than thinking about a technology as a tool for eradication, to start thinking about technology as a tool for managing what I see as yet another social relationship, which is that we have with disease-carrying mosquitoes. And so one example that I find really exciting, just to put this in concrete terms, comes from over in Tanzania, where local architects and local builders are working on designing bricks that promote ventilation in homes so that mosquitoes find it difficult to remain in those enclosed spaces, to lay eggs, and of course to bite people. So they've figured out how to make a low-cost brick that not only keeps homes cool, but also creates corridors of air that encourage mosquitoes to go elsewhere, to move outside of human dwellings, right? So there's no killing involved, there's no chemicals involved, and into the bargain, people get a technology that they can use to, over time, construct the kinds of homes that they imagine. I find that kind of technology really, really promising. And because I think it has a lot of upsides and a lot of multiple uses, and it keeps in mind some of the consequences of an excessive faith in the power of technology to solve problems, which those of us who've sort of followed the story of human-mosquito relations, I think, are pretty familiar with.
Thank you. I think in addition to what's been said, I think of it in terms of data quality, the kinds of technologies that can improve data quality so that the evidence that's generated is speaking to what's happening. And so I think that's where I think of where, in addition to what's been said, where technology can really take us, and thinking through creative ways of collecting data, of collecting, speaking to people in ways that, like she's just said, the social media or those, but just thinking more creatively so that the end goal is having, high quality of data. Thank you.
So for me, I see the role of technology. I think a lot has been said when it comes to the delivery of care, but I think it's also very important to consider the health education part of it. For the most part, the people that we serve, probably they don't have any idea of what a malaria is or typhoid is, and I see that technology can play a very key role in bringing this education to them so that they are aware of it. And from our work, we realize that once they are educated and they know, they are more likely to adhere to it. And so that is where I see technology playing a very huge role. What we've done from our small part is that we have this platform, wuhuhiame.com, where individuals can go in and learn about mental health issues and even listen to that in an audio format if they don't want to read. And so that is one way that we are using technology to promote mental health education. Again, I want to touch on the non-technology aspect of it, which I believe that mobile healthcare plays a very huge role. To be honest, where we serve people, no one would love to stay there or live there, even as a physician and nurse, because of the lack of development and the social amenities. However, they are willing to go serve when they know that at the end of the day they are going to come back home. And so from our work, we have a lot of doctors, nurses who are willing to volunteer, be on our van, go and serve, because at the end of the day they know that they are going to come home. So that way we are able to also bridge the human resource gap between the urban and the rural communities.
So I'm glad that our last speaker mentioned the non-technology part as well, so we got to that. Can we open up the floor to questions? Any questions? Our Cornell alum veterinarian over there, I'm going to give him the first question because he missed out yesterday. Oh, someone's...
My name is Anthony Akunsule, the Executive Director of the Ghana Poultry Network. My nickname is the Donkey Man. I've dedicated the rest of my life to protecting donkeys. Well, my first question goes to Professor. I like and I learned a lot from your presentation on the network of practices. But my concern is you raise issue of timeliness, reduce costs, and others. At that level, I see the lab diagnostic capacities as a key. So where do you place the laboratory capacity that can timely diagnose diseases at the community level? My experience with the veterinary services is that much of the diagnostic capacities are at the national level. Whilst, as you mentioned, at the district level, where much of the concentration of human health is, most of the labs are not well equipped. And knowing that these days there's this emerging antimicrobial resistance, medical doctors just prescribe broad antibiotics, where there's the need to do sensitivity tests before they can prescribe this. I had an interaction with some medical doctors, but say at the district level, those facilities are non-existent. Now, contributing to technology, in the Ministry of Health or Ghana Health Service, they have a technology that reports disease called SOMAS. I don't know whether Professor will know about the SOMAS. It is a surveillance outbreak response management analysis system, where diseases are reported at the community level to the district and then to the national level. In the veterinary services, because of the One Health concept, they also have what we call event mobile application. And they, as I said, because of the One Health approach, the Ministry of Health and the veterinary services are trying to have what we call interoperability of these two technologies. Now, another technology that I see that is really usable is rapid test kits. These ones, we have them in the veterinary services for diseases. And I think in the human health, for example, I think anybody can do a malaria test at any pharmacy. So it's a simple technology and can be used at this thing. And then Professor Keate also mentioned it, the WhatsApp group. These days, at the regional level or district level, people in the same category have that WhatsApp group. For example, in the veterinary services, we have the regional veterinary officers, and they have a WhatsApp group that they communicate on daily basis on issues upcoming. So this is my contribution for this. Thank you.
I did. Thank you. So you talked about the diagnostic capacity. I think one of the things we need to be very careful because fortunately we've had experience. I mean, I take myself as an example. I trained in Ghana and then I did my postgraduate outside. We really need to be careful so that we don't push medicine to just labs. One of the things that we are taught is that when people come to you, you speak to them, you examine them. By the time you finish examining them, you should have a fair sense of what the problem is. And then the labs would come. Because if you don't do that, we know labs have impoverished families. They've collapsed families because go and do this, go and do CT scan. The only thing you have to do, doctor, did you look into the throat? Doctor did not look into the throat. The problem is in the throat. You understand? So we need to be careful about it. And I keep on saying that most of the problems that we face, 80% of them can be solved at the primary care level. And we need to have that filter. It's the ones that they cannot, then they move it up. Now, if you go to the primary care center, it is true, lab is an issue. But you see now, increasingly, we are getting more what we call the point of care tests. So the point of care test, you don't need a laboratory specialist to do the point of care test. If I give you the malaria test, you can do it right here. If I bring you the HIV test, you can do it right here. So I think that is where we have to go, so that at least the resources that we have, we can optimize it. Otherwise, you would, and maybe US will be a classic example. I mean, if you are here and you go to the US and you fall sick, I'm sure they'll have to sell your family house to take care of you. You understand? So I think medicine can be made simple, and then so that those who need the CT scans, those who need the big investigations, at least there will be resources for them. So I think we can do that, and then also we need to have, like I said, that network and the support that they get from the higher facilities. In terms of the SOMAS, I think you answered yourself. It is important that it must be interoperable, because you see, a lot of these things, they are brought in by different entities. I know how SOMAS came in, and I'm sure you know, and it's been around, and then there are new systems. So I think it's important that these systems are integrated and mainstreamed, so that if you are using one, you can still have access to the other. Thank you. I hope I've been able to answer your question.
And the lady in the second row, thank you.
Thank you very much for this opportunity to talk about health technologies. For the past 20 years, we have been training biomedical engineers in this country. We have a lot of good students coming up with great ideas, and we've even tried to get them to go into the hospitals, to get into communities, to understand the problems that we face in order to come up with their innovations. However, they stay with us right here at the university. So if you are talking about partnerships, this is the opportunity to start thinking differently about the way we are training our students, the ones who have been in the communities and understand what is happening, and how we can get the necessary support to be able to develop our technologies that are relevant to the problems that we have here. I know students who are developing devices and platforms to support the issue of few specialists and professionals in our communities. So if you look at neurological disorders, how many neurologists do we have in Ghana? If you look at cardiologists, we don't have enough of them. Can we consider ways in which we can come up with technologies that will help us to support this? Technologies that are not imported, because that has been most of the problems that we have faced. And so this is something for discussion, and I'm happy for the opportunity to say something about this.
So really like, and I'd add to that, because from my own education, how do you take these technologies to market? Is a problem and an issue with. So I'll pass that over to the experts.
Sure. So I agree with Dr. Elsie, because I think it's very important, and even for us, when we were developing the mobile health unit, we did it in Ghana. So the local artisan did that, designed the whole thing in Ghana. We just bought an empty van, and then he did everything here in Ghana, because we worked with him. We went to the community, identify how we wanted it to be designed, and that was one of the ways he did that. And from the work that we do, we actually like that approach. For example, the case competition that we have, once the students come up with innovative ideas, we intentionally pair the Ghanaian students with the students in the US, because we believe that both of them bring value to the table. The Ghanaian students understand the concepts, the feasibility of the solution in Ghana, and the US students also are probably exposed to other solutions. And so we bring these students together to form a team so that they are able to provide like a solid, innovative solution to address that. And once that is done, we work with the students in Ghana to be able to implement that. And one was the mental health that I mentioned. So I think it's very important that we have that homegrown solution, because culturally is different, religiously different, and so it's very important that we acknowledge that and build solutions around that. Thank you.
To this issue of technology, we've had a lot of good technologies and basically transformational. But I think the challenge we face is that these technologies, it comes and we are all very happy because it makes such a difference. But these technologies cost an arm and a leg. So it offers, but then when you go to the cost side, then you ask yourself, am I getting value for money? So I think we really need to look more at homebrew technologies, or adapting the technologies that we use. And there are many examples in medicine that we have brought it in, it's helped us how we manage, and then we become extremely dependent, because, for example, when the machine breaks down, that particular supplier only, and sometimes they have to fly from Europe to come and fix the equipment. I think that is not sustainable. So we really need to adapt technologies that are sustainable over the long term. Thank you.
According to my clock, we have about 5 more minutes, so we have time for one more question. There's a gentleman here.
Right. Seth Bonyo. mental health issues. It's difficult to get this to be obvious. Of course, those in psychology and psychiatry say we are all, to some degree, have that kind of problem. So when we're pointing our hands to anyone, of course, we must always remember that yours, it can be you, even at any time. And yet, unfortunately, we find it difficult to face up to this challenge and always see people roaming around. The costs, it's clear that when you send anybody right now to the mental health facilities, it's very expensive. So what it means is that families are trying to run away from this, and yet are also not ready to face up to it because of the stigma. And I keep wondering how we actually should be able to handle this. I've had recent occasion where we had somebody, of course, eventually when she was able to speak, she said she came from somewhere in Pram and was sleeping around Ashaliboche. Went to the police, they couldn't do anything. What can we do to encourage ourselves, everybody, to be aware and to help and make sure that we are able to manage this situation better than we are doing now? On this campus, some of us have been creating some kind of awareness, but what the problem is that even when you provide opportunity, run workshops and so on, unfortunately, people, you seemingly think that they should avail themselves of that opportunity. They don't even come. So you find this problem lingering. I'm just wondering, we have a lot of people with bipolar, we have people with intellectual disorders and so on. And I've heard Hope Foundation, you do a lot with children in that regard. What can we do to be able to increase this awareness and also make sure that we are able to do better in catering for this, our mental health people?
Thank you.
All right. Thank you so much for your question. And as you said, mental health is not something that we can prevent. Everyone goes. Important. Provide them with the resources so that when they are going through it, they are able to cope well with it, because you can't really prevent mental health. And one of the ways that we've been doing that is through massive health education. But the thing that we also have to realize is that it's one thing to provide education, and it's another thing if you tell the person that this is what you're going through, what are the next steps for the person to get the right resources to continue. And unfortunately, when it comes to mental health, I think in Ghana we are still working on that. We are how we can improve the. But apart from the youth, there is a very huge problem when it comes to mental health in the rural communities. And the problem there is a little bit different, because people see mental health as a religious or spiritual thing, right? So in order for them to address that, they think that, oh, when I go to my pastor, they will pray for me and it would go. And some of the pastors, or even only pastors, but healers, don't really have the education about that. So where we see a lot of opportunity is how do we bring these people on board? How do we educate these faith healers so that when someone presents a condition, they are able to really, identify some symptoms and are able to refer the person or recommend the person to the appropriate health facility or healthcare professional. And a prime example of what we do is we went to one community where they still have prayer camps. So still people are still in chains when it comes to mental health. And once we went there, we were speaking with the mental health nurse there. And once we were speaking with him, he told us that, medically, the people are good, but when they are trying to approach the people, the religious leader or the faith-based leader will tell them that, they are not done with them spiritually. So they want them to be done with them spiritually before they leave the people. And so there is that disconnect between the medical and the religious, and the only way to bridge that gap is to bring everyone on the table, acknowledge that what the religious leaders are doing is very important because they've built the trust among the community members and be able to work with also the medical professionals to be able to provide the mental health care to the people. So that is what I can say.
Yeah, good. That was very, just to build on what he said, I think we also need to look at the spectrum of mental health diseases. I think it's pretty broad. You are coming from anxiety, move through depression, all the end to schizophrenia. When you get to the end, and then they strip naked and they walk around, they say, this person has a mental health condition. But it goes beyond that. And so if we need to have a system of diagnosing the mental health conditions. The unfortunate thing is that mental health in Ghana has been institutionalized. So mental health is associated with the mental hospitals. But I think if we try and integrate mental health in the primary healthcare settings, and actually there are packages for that. There are simple apps that have been developed where you sit in the clinic, you just go through and then find out whether you are at risk or you have a mental health condition. And then it's identified very early, and then treatment is given. And again, if you look at the data, and probably that's also part of the problem, a mental health condition typically will not kill you, unless maybe there is suicide or so, compared to a heart attack, which will just kill you. So when you look at the data of causes of death, mental health is down at the bottom. But if you look at morbidity, ill health, mental health plays a very big role. And the way to address it is try to integrate it at the different levels of our healthcare system rather than making it institutional, because the stigma is really sickening. So that's the only way that we should be able to take care of mental health at the district level as well as the health centers. Thank you.
Thank you. So I think we've come to the end of died. I just want to please join me in thanking them. And I also want to thank all of you for the fantastic questions. I think we have a half-hour break now. No, we don't. We're going to go straight in. Okay, no break. You have to stay here. And so we're going to leave and let the next panel come on.
I'm always holding. He's the
Hello? Hello? Kindly, we are taking a 10-minute break. There are some light snacks under the summer hat. Please just you can take some tea or coffee. We want to come back here in 10 minutes to continue with the second panel. So please, just 10 minutes. If you need to go to the bathroom to take a cup of tea or coffee, please do that. Please take your seats. Please sit. There's a lot of time for networking after this session. Would like to move on very quickly to our second panel discussion for this afternoon. This afternoon, the discussion will be moderated by Professor Rachel Besnaker. She's a professor of global development and director of the Institute for African Development at Cornell University. I'll do a very short introduction of her. She does long-term research in Malawi and Tanzania using participatory research methods to test the impacts of agroecological approaches on livelihoods, nutrition, and sustainable land management for rural communities. She has published widely. I'm sure we all have the brochure so we can read her full profile. She is the Director of Graduate Studies for PhD in Development Studies and Director of the Community Food Systems minor at Cornell University, which provides engaged learning experiences for students with organizations working on sustainable agriculture and food justice issues. When she's not working, Rachel loves hanging out with her family, gardening, and hiking. Please join me to welcome Professor Rachel Besnaker as she moderates this session.
Thank you very much, and I'm really honored to be here today. And I want to start by thanking the pro-VCs, the provosts, the directors, the deans, the faculty, and students of the University of Ghana. It's really a delight to be here this afternoon with you. And to my fellow colleagues from Cornell University, the provost, the vice provost, and my fellow faculty, it's really a privilege to be standing up here today. And I want to talk a little bit about the theme before I get to a brief presentation, and then we will move on to our panel. So our theme is looking at climate change, adaptation, and mitigation, which are really global issues, but sometimes require local responses. And this panel is going to present diverse approaches to addressing climate change adaptation and mitigation. And they've really been asked to reflect about what they see are the critical issues or questions in relation to climate change and how global collaboration fits into this issue and how their own organization or work contributes to addressing this major challenge of our time. And so I want to start by saying, and we can start the slides. My brief remarks at the beginning are with two hats. And the first hat is I had the privilege of serving as one of the coordinating lead authors for the Intergovernmental Panel on Climate Change, Working Group 2, which is Impacts, Adaptation, and Vulnerability to Climate Change. And I helped to coordinate, I was one of the coordinating lead authors for the food chapter, food systems. So I'm really going to hone in for thinking about climate change impacts on food systems, which I think is very relevant to Ghana, but also very relevant in the United States and globally. And so I'm going to spend a bit of time talking about the overall findings from that report, because it really comes to this question of how climate change is a major issue of our time. And then I will speak briefly about my own work and some of the others at Cornell and how they use transdisciplinary approaches to address climate change. And so it's not a surprise to hear that our assessment of the literature 2 years ago found that there's robust and growing evidence of the impact that climate change is having on our food systems, not only in terms of slowing down agricultural productivity, so having dampened agricultural productivity compared to if we didn't have climate change, but also, and you would be aware of this here in Ghana, the different extreme events that are having tremendous disruption on our food systems, impacting the overall productivity, impacting pollination, soil health, and other ecosystem services that are crucial for producing food, affecting our fisheries, affecting the overall yield of some fisheries, moving our fisheries to other locations, very relevant for a place like Ghana. And then these extreme climate events having significant impact, and now there's robust scientific evidence showing the linkage between these acute extreme events like droughts, like floods, like wildfires in the United States, and their relationship with acute food insecurity, and also affecting reduced dietary diversity and impacting livelihoods, and all of this together leading to impacts on malnutrition. I'm causing problems with the mics here. So in our assessment, we looked at what is a common approach to agriculture in the world today, which is agricultural intensification, intensive use of chemical fertilizer, pesticides, mechanization. And what we found in the literature, the scientific literature, shows that although this can have short-term impacts and increases in food production, it can lead to negative impacts in terms of ecosystems that support our food systems, things like soil erosion, salinization, and it can also have displace local food producers and actually worsen their food security. And so overall, this approach to agriculture can increase climate risk and vulnerability, particularly for those who are marginalized already and at risk of food insecurity, such as farm workers and smallholder farmers. A key message of the overall report, not only for our chapter on food systems, but overall, and I had the privilege of contributing to the Africa chapter, to the risk chapter, to the final chapter, and this was an overarching message as well, that it's not only that particular regions of the world are at greater risk from climate change impacts. So we know sub-Saharan Africa, we know that Central and South America, South Asia, small island states, and the Arctic region are at greater risk in terms of food systems, risk of food insecurity and malnutrition. But marginalized groups, not only in Ghana, but in the United States, who are already experiencing discrimination, may be at greater risk, are at greater risk from food insecurity, from climate impacts and loss of livelihood. So those marginalized groups vary by place, but include women, ethnic minorities, low-income households, farm workers, and smallholder farmers. And this is particularly for food systems that I'm talking about. And so in terms of adaptation, what we found is there's strong evidence in the literature that it's not enough to focus on a technical approach, but you really need inclusive governance strategies that bring in those marginalized groups from the beginning to co-design and work on those strategies together. And so we heard an example of that this morning with Alex Nading in terms of housing. So really co-designing and implementing adaptation with those groups most affected by climate impacts in that region. And otherwise, you are at risk of having maladaptation, and there is strong evidence in the scientific literature for maladaptation, which can increase greenhouse gas emissions, which can degrade ecosystems and or can worsen climate outcomes for particular marginalized groups. And another key finding from the overall report, this was in the summary for policymakers, but was also in our chapter, was that ecosystem-based approaches to adaptation that really take into account biodiversity and try to strengthen ecosystem services, such as agroecology, which is the approach that I am doing research on. This ecosystem-based adaptation not only can reduce climate risk and things like buffering from climate extremes, but it also has many other co-benefits for communities, such as food security, nutrition, improved livelihoods, as well as strengthening biodiversity and the ecosystem services that support food systems. So now just a brief couple of snapshots, a little bit about my own research that I've been conducting with collaborators at Cornell and also with people in Malawi, Tanzania, and also scientists from Canada, Germany, and Norway. We've been doing long-term research, testing different agroecological strategies with smallholder farmers. And we've done pre-post control intervention research projects that use this agroecological approach, which really draws on ecological principles, but also social and economic principles, such as addressing inequities in communities and in society as part of the design. And what we have found is there's consistent evidence from our studies that this approach can lead to significant improvements in smallholder communities in terms of food security and dietary diversity. So for example, in Malawi, we found evidence of women having improved dietary diversity. In our Tanzanian studies, we found improvements in children's dietary diversity. And we also found there were multiple ways by which households improved their food security and dietary diversity. It wasn't only that they were growing often more crops, so crop diversification is a common agroecological practice, but they also were saving money because they weren't purchasing as many inputs. So for example, adding compost, legume intercropping was building soil health, and this saved money on commercial fertilizer, which they were then able to invest in other strategies to address food security and improve livelihoods, things like small-scale dry season vegetable gardens or animal production. And another finding that we found in our research was that addressing gender inequity was a key pathway for improving food security and dietary diversity. So for example, spouses where men and women were discussing what to grow and how to farm were much more likely to improve their food security and dietary diversity in Malawi. And in Tanzania, and this touches on the theme just before our break, we found that women's likelihood of probable depression, so a mental health issue, was significantly lowered for households who were participating in these agroecological interventions that also addressed gender inequity, and that it was partially due to improvements in food security, but also because men were helping out more in terms of household tasks, things like cooking and laundry, and this had a significant impact on their likelihood of being depressed, i.e. they were less likely to be depressed with that involvement of men in the household. So our overall finding, not only from our research, but from other researchers using this approach, is this participatory research is part of what helps build resilience in communities to climate change. They're improving their ecosystems, so they're increasing their knowledge about how to improve things like soil health, which helps build resilience for example, droughts. Crop diversification helps to reduce the risk from crop loss of one crop. So they're improving their knowledge about these strategies, and in turn that makes them more resilient in the face of things like drought. But they're also more organized at a community level, and they're sharing their knowledge with one another, and that's part of this participatory research approach. It's not only that farmers are working alongside scientists to co-learn and co-design, but they're working with one another, and they're experimenting and then sharing with one another about what they're learning. And this helps them be more organized and prepared in advance of a climate shock. We've been recently doing research on the landscape level effects, and we found that farmers who are involved in these participatory agroecological research projects are more likely to value forests more, and they're more likely to put land under fallow to support natural forest regeneration. And we also found increased levels of wild biodiversity in communities where many farmers were using these practices. Things like butterfly species richness and wasp abundance. And that has long-term implications for the ability of those communities to sustain food production long-term. Just two quick snapshots before I turn it over to our esteemed panel. We have Erica Steiger, who has been working, she's part of the College of Agriculture and Life Sciences. She's an agronomist, and she does participatory research really focused in on sustainable rice intensification. And she also uses this participatory approach, working with farmers, extension workers, and nonprofit organizations to test different strategies, such as adding compost to rice to try to reduce the use of water use and chemical fertilizers, early planting, and try to minimize anaerobic conditions. So this approach has both adaptation benefits as well as mitigation benefits. And she's been involved in rolling out this climate resilient rice production research across, I believe it's 13 countries in West Africa. And Holly Tufin, who's been a visitor here at WACI, is a plant breeder who really tries to take an inclusive approach to plant breeding. She's also in the College of Agriculture and Life Sciences. And her team has been doing breeding on cassava production, for example, that tries to look at women and other marginalized groups and their views about what are important traits in terms of cassava production, and really paying attention to breeding that will be beneficial for the household and trying to understand how cassava is used within households, but also looking up the value chain. So working with marketing of cassava, looking at how cassava is marketed and distributed, and trying to breed with that larger food system in mind, as well as what's happening within the household. So those are just two additional snapshots for what transdisciplinary research might look like in terms of the food system in fostering adaptation to climate change. And it goes beyond solely focusing in on one technical approach, and really brings in a wide breadth of scientists. So I work with agronomists, nutritionists, geographers, and as well as nonprofit organization folks, extension workers, and of course farmers. And so it really takes much more than a single science to try to tackle this major global problem. So with that, I think that is the end of my brief remarks, and I am about to introduce our esteemed panel. Thank you. And I want to introduce our panelists and invite them to come to the stage, and then we will hear from them and their thoughts on this important topic. So I want to start with Professor Eric Dankwa, who's a professor and is head of the West Africa Center for Crop Improvement, WACI. He's both a professor at the University of Ghana and thank you. And next, I would like to invite Dr. Nilante Amisa, the senior lecturer in Family and Consumer Sciences at the University of Ghana, who's also an alum of Cornell. And next, please, Dr. Dolapo Anaharo, who's the senior agricultural economist at ILRI, the International Livestock Research Institute, also an alum. And then last but not least, certainly, is Godfried Odamten Sowa, the program lead for agribusiness at the MasterCard Foundation. Thank you very much. So I hope I didn't talk too quickly. I wanted to make sure we had enough time for this wonderful panel. And I would like to welcome Professor Dankwa up to the podium, or if you want to sit down there, either way, and share your thoughts on this theme. We're going to go one by one, and then we'll have a chance for a conversation.
I have some slides, so thank you. Right. Okay, thanks, Rachel, for the kind introduction. Good afternoon, everyone. Rachel has provided some very good background, and so I'll go straight into a conversation that will throw light on what we are doing at the West Africa Center for Crop Improvement. I am Eric Dankwa. In 2007, we tried to put together a team to confront a number of issues. Today, what I want to present is about what we are doing in the area of climate resilience. So we are looking at breeding climate resilient, nutritious, and productive crops. In this brief presentation, I'll hit on 3 key points. One is addressing climate change, and Rachel did point to a few issues. Climate change is real. I recall in 2017, we had a conversation in Senegal, and we're talking about how we had to change the U.S. global strategy because, of course, the new government in the U.S. was not thinking about climate change, and we had to think about something else. And I said, look, plant breeding is a game changer, historical game changer, and we have been breeding for changing environments since millennia. So we better go to breeding for changing environments. So I'll talk about addressing the climate impact, addressing climate impact, and then leveraging global partnerships, and we'll highlight WACC's role in this whole saga. I think it's important that we remember that we cannot isolate climate change. Climate change is within a context, and the burgeoning population in Africa is troubling, and if we look at Ghana alone, our current population is about 32, 33 million. In the next 6 years, we'll have over 5 million additional mouths to feed. How can we feed them in the context of changing climates, reducing yields? Productivity is so low, and of course, the COVID-19 pandemic did warn us. The lesson from the pandemic was that we cannot wait for planes to arrive from Paris or, if you like, Tel Aviv. You got to be self-sufficient locally. And so we've been thinking about how to be self-sufficient in this country. And you look at the challenges of climate change, several. Of course, the floods are coming when we don't expect them. Diseases and pests are on the increase. Productivity is so low, and you have to confront them using good science. And this is some of the things that we are trying to do at the West Africa Center for Crop Improvement, how we highlight genetic innovation to develop new crop varieties for Africa. Of course, the food and nutrition security has become so troubling. What we try to do is to leverage global partnerships to design new crops. In fact, we have to start from the baseline. If the crops that you put in the hands of farmers do not have the inbuilt resilience, forget about it. The crops will fail. And recently, along the banks of the Volta River, there were serious floods. The soils became so terrible, and farmers were losing all their crop overnight. How do you build in the resilience into the crops so that they can withstand floods, saline soils, toxic soils, etc.? We are using a range of methodologies. We call it integrated approaches. We are using phenotyping, genotyping, advanced platforms. We are looking at partnerships for genome editing. And you find that you don't, as a single institution, own all genetic resources. So global partnerships become very important here. For example, a case for maize, we are looking at how we use speed breeding to accelerate maize breeding. Normally using conventional means, it will take about 8 years to develop, if you like, a haploid line so that you can go into hybrid breeding. But using double haploids, we can shorten it to 1 year. Within a year, we can have the double haploids so that you can speed breeding of maize varieties which are resilient. We are doing this in partnership with Iowa State University. What they have done is they have licensed 3 temperate haploid inducers to us.
So we can use, and this is the first time we have accessed such genetic resources in West Africa. We could use these temperate haploids to develop tropical haploids, which will accelerate breeding of new varieties for the entire West Africa. So this is one area you pool resources, genetic resources, you pool funding, knowledge, expertise, and fast-track the development of new varieties for the tropics, and this is something that we are doing in partnership with a number of institutions. The range of technologies that we use span what you can find, and we need to look for new adaptive traits, of course, for food security, sustainability, and resilience. And in the range of crops that we are looking at, we think that we are on top of accessing the kind of partnership that we need, which will allow us to develop the new kinds of crops that we want to put out on the markets. And the story of the West Africa Center for Crop Improvement, I told to Cornell University yesterday, so I wouldn't go over this in detail, but I want to highlight that without international collaboration, we couldn't have come this far in the kind of work that we are doing. It's important that you assemble expertise from all over the world, so together you co-create the future. So we are working with partners, and it's important that we trust and respect, like in the conversation yesterday. What is important is that you co-create, and so when it comes to conceptualization, you have to sit down and think together. And this is one area that I think we have to be thinking about seriously. There was a comment yesterday in the panel which was a bit troubling to me, because I believe that we have to be careful about how we are losing talent in Africa. I believe, and I have known from the records, and I've had conversations with a number of people, there is an intentional drive to steal talent across the world to certain wealthier countries. And I tell you, if we leave the problems in Africa, and like Gordon Wandari said yesterday, I mean, now plant breeding has no borders. The problems are going to hit you from Africa. And so let's keep the talent in Africa and ensure that we train them well in Africa for Africa, so that we can solve African problems to cut down on migration of talent out of Africa. I think it's one important thing that we have to look at. The outcomes of our work, of course, these outcomes have won so many accolades all over the world, and I don't have to go over them. I think it's important, but what we have said is that this is the kind of record that I want the provost to take away to Cornell, because if you have institutions like this in Africa, I don't see why inflows should not come from your global strategy. Because what we want to do is to enhance capacity in Africa. And if you have found a winning institution, all you want to do is to see how you strengthen that kind of partnership so that we can take what we are doing forward. I think it's an important area that we need to look at critically. You look at, and we have benchmarked, you look at the numbers. You see that for numbers, we are doing better than most of the universities in North America. 101 PhD students over 11 years. They started graduating from 2013. So in 11 years, we've graduated 101 PhDs. You don't find that at the Plant Breeding Center at Cornell or Purdue or Michigan State. I think the records are correct. And Mr. Provost, the challenge has to do with quality. But I can speak to the quality of the kind of graduates that we have turned out who are battling resilient crops all over the sub-region. The quality is as good as you'd find anywhere. And the problem now we face is that the CGIAR and some private sector institutions are hiring some of the graduates that we train for the NAS. And it's a challenge that we have to look at seriously. And I'm beginning to have conversations with partners to see how we can take that forward, how we can stop. Of course, like football, if you hide someone from a team, you have to pay, what do they call it? Compensation for hiring someone from a different team. So we have to begin receiving, if you like, funding for our students that they hire. A number of research areas that our principal investigators are looking at has implications for climate adaptation. In cassava, we are using modern technologies to ensure that we develop resilient and nutritious varieties. We are looking at, and here we've begun some work with ETH Zurich, and we are seeing how we can explore a partnership to develop
cassava with high dry matter content, and also cassava that is resilient against, of course, the viruses that attack cassava. In cowpea, we are using modern technologies to develop, if you like, new cowpea varieties for Africa that are herbicide resistant and also that are resistant to, if you like, the maruca butterfly. We are trying to work on other neglected species like frafra potato. In frafra potato, we have tried to develop new varieties for the northern part of Ghana. In tomato and bambara groundnut, we are releasing new innovations for farmers. In sorghum, we are working on resilience using genome-wide selection. In maize, we are advanced in maize. We have shown that in maize, we are one of the lead institutions for maize breeding in West Africa. And in rice, we just brought rice on board. We are working on rice, trying to see if we can release new varieties for West Africa. We want to show some of the partnerships which are leading to products that we can take forward to farmers. And here with Purdue University, we tried to release some new lines of sorghum that are highly protein digestible. So of course it means that you get more nutrients if you use such varieties, and it's important in the era of climate change that the varieties that you give to farmers are nutritious. So you have less, but you have quality, and you become, of course, fitter if you got access varieties which are highly nutritious. So we are looking at protein digestibility in sorghum. Then in maize, we are looking at, of course, this is like the serious viral disease of maize. It can totally devastate the crop, and we are using good science, identifying genes for resistance against the MLN disease, maize lethal necrosis, a very devastating disease in maize. We have gone far in this work here. We did a work with Summit East Africa, releasing some lines. We are taking this work forward, which is going to get to farmers. And with climate change, maize lethal necrosis is going to get worse. So farmers need resilient varieties, very important. We are looking at iron toxicity, which is very important with flooding, which comes with climate change. And very important work we did with Cornell University over here, published in Experimental Botany. Great with Susan Makuch. What we identified here was rice lines highly resistant to iron toxicity. And if we can integrate this into the cultivated varieties, it means that you can take good varieties to farmers. Very important work that we are doing here. In also maize, we are looking at combined heat and drought resistance, which is very important with climate change. So all of this work, we are working together with partners. Here, nitrogen use efficiency, an important trait that we want to look at, and we are working together with farmers in all of these. In fact, all the students who come to the West Africa Center for Crop Improvement engage farmers in their conceptualization. So before you formulate your working hypothesis, you should have interviewed over 200 farmers, and you build the farmer's history into your research questions, and you're able to develop varieties that farmers would take, which is very important for research. For us at the West Africa Center for Crop Improvement, what we have done well is to release maize varieties which should hit farmers' fields. Of course, because of the poor government policy, it's not possible to get these varieties to farmers because, of course, come planting time, they are going to import some useless varieties from elsewhere and then subsidize for farmers. The time has come for us to build local innovation and put innovation in the hands of farmers, innovation that is developed in country. Our maize hybrids are better than most of the maize hybrids that are imported into this country. So the time has come for us to look at policy and see how we put our own innovations into the hands of farmers. In tomato, we have also made history developing new tomato lines for West Africa, which is also going to farmers. We are now thinking about taking the work we are doing to the high level, and of course, I think this is good for Cornell University. We have developed a concept we are sharing with a number of partners. If we want to put proper innovation in the hands of farmers, we want African scientists to sit down with their colleagues in the global north and the far east and think about how we solve the global problems. I want to pick two key questions. For example, the work at the University of Illinois on ripe photosynthetic efficiency in wheat, rice, and maize, led by Peter Long. That grant was given by the Gates Foundation without recourse to Africa's capacity to also innovate in the area. And recently we've started questioning some of the foundations which preach equal lives. You cannot fund such projects which have implications for Africa's development without any African partner. Another project has to do with the NSAP project enabling photosynthesis and nutrient symbiosis in cereals. I think, which was awarded quite recently, about a $35 million project without African partners. We believe that there should be African partners in all of these global projects. So what we are doing at the West Africa Center for Crop Improvement is to launch a new initiative and ensure that all the foundations are aware that we are in partnership with some of the big institutions in the world to address global challenges, and it's important for them to come and work with us at the West Africa Center for Crop Improvement. Then the model is quite simple. We work with global partners to ensure that if you came from France or the UK to begin your career at the West Africa Center for Crop Improvement, in a decade you should be the lead scientist in the problem you are working on. And all scientists from all over the world must be looking at you as the reference contact for example, work on Bambara groundnut, which is our indigenous crop. I don't see why there should be better scientists on African crops outside Africa than in Africa. And that is what we are trying to begin to champion at the West Africa Center for Crop Improvement. And I believe, Provost, you can go back thinking how we can ensure that this comes into reality in the next couple of years, because we need to accelerate this. And when I saw Cornell's budget, $1.18 billion for 2022, I said maybe Cornell should start thinking about equity and see how you can subsidize the research budget of some of your African partners so that together we solve the grand challenges in the world. I think it's an important conversation that we want to have. So for me, I think transforming African agriculture has to do with many complexities. It will call for uncommon partnerships. It calls for urgent and unprecedented action, partnerships that are strategic, that takes account of all that we need, so we strengthen the kind of work that we are doing together to address the problems of the world. So with these few words, let me sit down and then answer questions.
Thank you. That's a lively and passionate start to our panel. And now I would like to call on Dr. Nilante Amisa to please come forward and share his thoughts on these questions.
Thank you very much, Prof. Rachel. So I'm happy today that as when I was at Cornell, I was an Institute for African Development Fellow, IAD Fellow, and that today we have the Director of IAD here with us, and then we have the Program Director for IAD here too, and then we have the Director of the Mario Ainaudi Center, which IAD falls under, so all of them are here present today, so it's very nice to have you here. So then, within the University of Ghana, we've been working with transdisciplinary approaches to our research programs, and within the College of Basic and Applied Sciences where I reside, we have been working together and harnessing synergies in our research to achieve results. So you'd realize that within the food value chains, there are multiple disciplines that are involved in getting food from farm to fork. And now that we are having problems with climate change and the need to adapt to these changes. How do we go about this? So we have identified some indigenous foods, fruits and vegetables that are resistant to climate change. And you realize that they are nutritious, and some of them could be more nutritious than what is commercially available, but then they are underutilized. And some of the advantages they have is that they are able to withstand some of the challenges or the adverse conditions with the climate. Some of them are able to function by using less water or less fertilizer. And some of the identified fruits and vegetables would include like the African star fruit, also known as alasa, star fruit itself, amaranth, jute mallow, spider plant, also the frafra potato, turkey berries, fonio, neri, miracle berry, and then bambara groundnut. So we've done some work with the frafra potato, looking at physical chemical properties, sensory properties, and for some of the other plants as well, we need to look at these properties, how they functions rheologically and so on, pasting properties, how it can be utilized in food applications. So we've done some of the groundwork in frafra potato and a few of the other crops, and we have work ongoing to be able to make progress to move them on to value-added food products. So to be able to do this, we have to collaborate across the value chain with our plant breeders, also with the crop scientists who may be involved in trying to propagate these crops. So some of the research that will come out of, say, Professor Nina Basuk's lab, you'll find that very useful, modify that into doing the plant propagation. We'll also have to involve the post-harvest technologists so that they can ensure that these foods, once they've been bred and harvested, that we can reduce post-harvest losses and make them last for long enough so that the food processors and marketers can get in touch with them. So we also need the food scientists, the sensory scientists, and other aspects of food science, and the consumer as well, so that we can have a consumer-led approach in developing the food products for these foods. So we also need to utilize the food engineering, the food engineers, the other engineers, as well as processing and packaging technologies to be able to extend shelf life and then have products that the consumers are interested in consuming. So when I spoke about the post-harvest technologies, it would be nice to see, similar to what Professor Chris Watkins has done with apples in the Cornell orchard, to be able to have something similar in Alasa or some other fruits, have that kind of level of post-harvest technology research ongoing here. So there's a need to train the youth in ideation, concept development, developing prototypes, especially in the food product. So once we have these indigenous fruits and vegetables and we've produced them and harvested them, we need to have the food products. And the scientists, we've been involved in doing this for a while now, but it's good to train the youth that are up and coming in these steps of product development so that they can conceptualize and come up with prototypes. And once they have these prototypes, it will mean that we need the equivalent of test kitchens and pilot plants so that we can produce enough of them to test the markets for these products. So it will be similar to what the Food Venture Center at Geneva, which is headed by Professor Olga Padilla-Zakor, is doing, working with farmers in upstate New York. So we'll need to have these test kitchens and pilot plants so that we can move the products forward. And also with the youth that I was talking about, there's a need to help them to be able to see and have hope in the future and know that they can have their own ideas, birth those ideas into tangible prototypes and products so that they can also participate in having some intellectual property rights, having some products that they have and then they can have some co-ownership of. And you find out that with regards to food processing equipment, it can tend to be very expensive. So if we have the test kitchens and we have the pilot plants and there are co-packers available, it means that people who have an idea with the right technological support from the scientists, they can have their products see the market and get onto the supermarket shelves without necessarily having to invest in all of those expensive equipment which could serve as roadblocks or stumbling blocks to them. So with this, we could move the youth forward into helping to get our climate adapted fruit and vegetables in food products that they themselves have come up with. So it's similar to what happens in Food Science 101. So in the past, Professor Joseph Hotchkiss would ask his class, divide them into 3 groups, and ask them to come up with an ice cream that had never been made before. So the students will come up with these concepts, come up with the products, and once they were given the ingredients and so on, they were able to move their ideas and come up with innovative ice creams, including Sticky Buns, which was an award winner many years ago, and also See You in Cornell, and other ice cream flavors. So you realize that every year, the university has a new ice cream flavor, which was entirely developed by their freshmen. So taking a similar concept, we can challenge our own youth to also come up with innovative food products. So with the job creation, we need to have the business and legal areas supporting so that the medium and small scale enterprises can move forward with the work that they are doing. Also, with a seed grant from WACI, we were able to do field trials across 3 agroecological zones for Frafra potato and are in the process of releasing 5 varieties. Also, the Africa Climate Change Adaptation Initiative, ACAI, and the Building a New Generation of African Academics, BANGA, has supported work on Frafra potato, where we've done physicochemical work and some work in seeing its application in baking, for example, use in bread. So at this moment, we have the Feed the Future Innovative Lab for Horticulture out of UC Davis, promoting food and nutrition security in West Africa through indigenous, neglected, and underutilized fruits and vegetables through the West African Regional Hub, the Innovation Lab for Horticulture. So with that work, we are looking at determining the diversity, physicochemical, socioeconomic importance of our indigenous fruits and vegetables. We are also determining functional and sensory profiles using a consumer-led approach, and the aim is to develop innovative value-added food products to promote consumption and also increase the awareness of these innovative indigenous foods and vegetables through school gardening and also the school feeding programs. So the expected outcome is that with the greater utilization of our underutilized fruits and vegetables, it will help to mitigate the effects of climate change and enable us to adapt effectively. Thank you.
Thank you very much. And now, can I invite Dr. Delapo and Haro up to the podium?
Good evening. I'm indeed honored to be here and very thrilled to be reuniting with Cornell folks. It's been a while. And like the last speaker said, I'm happy to see the program director for the IAD, particularly thrilled to see you, Jackie. Happy to see and to meet the director for the Institute for African Development and for the INADI Center. And of course, the provost, the faculty, students, everybody here. It's good to be here. I'm a senior agricultural economist with the International Livestock Research Institute. I lead ILRI's global work on quantitative foresight analysis. What does that mean? So basically what we do is to look at the interactions for multiple disciplines and to look at the interactions of the impacts and the drivers for livestock system over the long term and bring that information back from the future for decisions that need to be made today. So that's what that is about. So I do that work at the global level. At the national level, I lead ILRI's work developing a livestock master plan for Nigeria. And in Ghana, I coordinate the implementation of ILRI's projects in Ghana. So I sit in a unique position at ILRI where I have one foot at the global level, one at the downscale level, and still sit somewhere in between at the national level. So so that gives a good overview picture of what we do at ILRI, and that's what I would be presenting today. We have heard about the climate change challenge. Livestock sits very comfortable in the middle of that conversation. And there are two thoughts that are really driving the discussion about livestock in the public space. One of that is about the negative impacts of livestock production. So you immediately start thinking about increase in greenhouse gas emissions, about pollution at the ground level, pollution of waters. There's also, on the consumption side, and livestock has often been associated with, at least the overconsumption of livestock has often been associated with non-communicable diseases, with obesity, with cardiovascular diseases. But that is one side of the story. It really is very nuanced. Livestock production globally is very diverse, which means that its impacts in agri-food systems, its role in agri-food systems is very diverse, and it means that it needs different approaches. So at ILRI, we work to improve food security and related outcomes using better and more sustainable use of livestock. We do this in the context of the CGIR, which Professor Dankwa has accused of stealing his graduates. So we do this in the context of CGIR, which is a network of international agricultural research centers. We have a reach in about 96 countries globally, mostly in the global south. And our livestock approach has two objectives. One would be that we want to minimize the external, we want to minimize the external negative effects of livestock. That's the effects that have to do with production, that have to do with consumption, that are negative. And on the other hand, we want to accentuate the good services that livestock provides. And we already heard earlier from Professor Besner-Kerr about people in agroecological situations looking to livestock as part of the solution and also using livestock as savings. So animal source foods are a key source of nutrients, and they're particularly important for vulnerable groups. They're important for children. They're important for women of reproductive age. Now, livestock, again, the ownership of livestock by itself has been associated with improved diversity in diets and also with reduction in stunting, reduction in anemia, particularly among children. And then in many communities where women cannot own land, they typically can own livestock, some form of livestock, and can derive incomes from that livestock. So there's, again, a gender equity dimension to livestock. And our work at ILRI is broadly clustered around addressing issues of animal breeds and genetics. So it would be the contemporary, I guess, of the work that's going on at WACI. We do have a lot of cutting-edge technology going on, cutting-edge science going on with animal breeding. And in the context of livestock, it would be looking at specific breeding to deal with mitigation, to deal with adaptation to climate change. So this is, you want to increase production efficiencies, but on the other hand, you have your eyes on the food security goals. So you have to, you're doing science that deals with the trade-offs and tries to address those trade-offs at the unit level. We have work centered around scaling of technologies. And so this is where work around sustainable livestock systems. So this is where we're trying to scale those technologies, and typically some of these technologies have been developed for a completely different system. And so we have to look at that and say, how can the smallholder farmer benefit from this cutting-edge technology? And that's the type of work that we do at ILRI around sustainable livestock systems. So there's scaling. We do a lot of work around building resilience, and some of that would building resilience to climate risk, and some of that would have to do with the financing mechanisms. And one of our flagship projects in this regard would be the index-based livestock insurance that has been piloted in Kenya, in Ethiopia, and is seeing some inroads in the Sahel in West Africa. Now, then we also have the digital tools that you need both for scaling and for helping people to adapt to risk, because they need market information, they need information about the breeds and about feeds, for example. And around all of this, we do work on foresight, on policy. We look at value chains, and we look at market systems. We also do specific work on gender and on nutrition. And then we, again at ILRI, put a lot of emphasis on the partnerships, on the advocacy, and on communications. So you can think of 3 key technological fronts with which globally people are addressing the direct use of livestock to address climate change. So one of those would be the science that goes into things like breeding for mitigation and resilience. And then at ILRI, a lot of the work that we're doing is around the access to those technologies, around making available the genetic resources, both for animals and for feeds. There's another body of work around the reduction of methane emissions from livestock sector, and that's where our feed work will go into. For this one, I said at the beginning that livestock systems are very diverse. So for example, in an extensive system, you have almost limited potential to use feeds as an entry point to address climate change. This is simply because there's not a lot of stall feeding happening there. So at ILRI, we have to try to understand. So when you don't have stall feeding, do we want to move extensive systems in that direction? What are the trade-offs to doing that? And if you do agree, or if the evidence shows that you need to do a bit of moving into that direction, how should that be done? And then the last part I would want to talk about that global approach to addressing livestock and climate is the adoption of alternative proteins. Now, this is something that has become it's a topic that has become very popular in the developed world. It's about veganism, it's about vegetarianism, it's about alternative types of proteins that have come from fermentation and other technologies. Our view at ILRI is that there is a place, definitely, in the discourse for these technologies. But they should not be applied everywhere and under every circumstance. Because in certain, particularly in low-income economies, we're actually dealing with a case of too little livestock or too little animal source foods being eaten, not a case of overconsumption. And so that debate needs to be nuanced, it needs to be more robust, and ILRI brings that dimension to say, let's look at the people who do not have enough. So yes, definitely let's reduce the overconsumption in countries where that is the norm. But even in countries like in the low-income countries, you do have groups that are emerging that have a bit more income than others, and we're also starting to see cases of obesity among those groups. So definitely you need to address the overconsumption of animal source foods. But this needs to be done in context, and that's part of the work that we do at ILRI. And a key unknown in that discussion about alternative proteins is what are the implications for smallholder producers and what will be the implications for poor consumers, people who cannot afford to buy high-tech fake meat, if we can call it that. Okay. So we work with a lot of, in a collaborative manner, and to move this sort of work forward, you need a committed ecosystem of collaboration. This goes from the upstream, if you want to call it that, research, to the downstream research. You need collaboration between the two. You need North and South collaboration. And when you come to countries where you want to implement action, you do need to see collaboration between research, between extension, between the government, because policies need to change. I think I heard that already today, that sometimes you have all of these technologies, you do not have the enabling policy to make these technologies bring fruition to the systems. So you need the collaboration of the government, the policy people, you need the implementing agencies, the development partners should be on board in there, the NGOs, and the private sector. Very often we leave out the private sector and the NGOs. And so or we do not engage them alone, at least enough, at least not on the national scale. And so in all of that, I would want to just leave us with maybe 3 thoughts. One is that livestock research for development has a very important role to play in climate change adaptation and mitigation. 2 is that much work is already being done in that area with regard to creating the technologies and sharing the technologies. And finally, I would want to say that the desired outcomes that you want from that body of work can only be actualized with a multi-pronged approach that transcends discipline and even agri-food function. So it transcends policy and it transcends production, improving production at the farm level. So those would be my 3 thoughts. Thank you very much.
Thank you very much for bringing that perspective and focus on livestock. So much appreciated. And you mentioned the private sector, and we are ending our panel, not ending the panel, but ending our last speaker is from the private sector, Godfred Odamton Sowa, the program lead for agribusiness for MasterCard Foundation. Please join us.
Good evening. I think it's right for me to say evening, right? Yes, good evening. Really excited to be here today. Lots of information has been shared, but more importantly, I see a lot of young people here, and so that gives me a lot of excitement to see them here, to listen to what we have and see how we can all work together. So thank you for coming. My name, as has been said, my name is Godfred Odamton, so I'm the program lead working from the MasterCard Foundation Accra office. But for those of you who you're not too familiar with the MasterCard Foundation, please give me a few minutes to make a quick introduction, if I may. So we are one of the largest private foundations in the world with a mission to advance learning and promote financial inclusion to create an inclusive and equitable world. The MasterCard Foundation was established in 2006 through the generosity of MasterCard Inc. When it became a public company. We have since operated independently. We have our own board of directors and our leadership who determine our policies, our operations, and programs that we do. We operate in Canada, but also 7 African countries: Senegal, Nigeria, Uganda, Kenya, Ethiopia, Rwanda, and Ghana. In Africa, currently, we are implementing the Young Africa Work Strategy, which seeks to enable 30 million young people, 70% being women, access dignified and fulfilling work by 2030. In Ghana, that number translates to 3 million young people, again, 70% women, accessing dignified and fulfilling work by 2030. And what really informed us as to how to achieve this, we did quite a bit of consultation, and we identified agriculture and agri-adjacent sectors as the priority sectors to enable us unlock work opportunities for young people. So there's a lot of work that has gone in, and we realized that to really unlock work opportunities at scale at this time, it is important to focus and prioritize agriculture and agri-adjacent sectors. Now, coming back to the discussions that we are having today, and a lot has been said already, I'm really excited as to the kind of information coming out, and I feel like I should be sitting on the other side listening to the information that has been shared already. But we do understand that climate change and adaptation are global concerns that require the collective expertise, knowledge, and experience of stakeholders from around the world. And for us at the foundation, that is why we believe in co-creating solutions. And so we typically would start with, what problem are we trying to solve? Who are best placed to help us address that solution? How do we bring them together, and what would it take? And so we go through that in almost all our programming, just to ensure that we are getting contributions from across all the various areas. As we put all this together, we can then expect to have sort of a systemic shift in the way we do things. Currently, we are engaged in quite a number of climate-related initiatives across the country that aim to adapt and mitigate the impacts of climate change and increase community resilience. I can share quite a number of examples, but I wanted to stick to the 7 minutes, so I had to cut it short. The first one is, we have a partnership with IDH on a project called Grains for Growth. And this project looks at increasing productivity along some key value chains. There is sorghum, there is rice, there is fonio, there is millet. And one of the things that we have been doing on that project is, usually the rice farmers would use, they'll cut down shade trees and use the trees for fire, sort of fuel for parboiling rice. Now, as a result of our intervention, there's been a gradual shift where they are now using rice husk as briquettes for what we call fuel wood, clean energy, so that they are gradually shifting and moving away from cutting these shade trees. Interestingly, we also have another intervention in the share industry where we constantly get this feedback from the share pickers that they get a lot from these share trees, but unfortunately, some of the value chains need firewood, and they use the share trees as firewood. And so it was a big concern to us. And so as we usually, when we get these feedback, we would come back to the office and co-create and reach out to who can really advise. And today I've heard a lot, and I'm sure we'll be reaching out. And we sat down and we thought through some of these things, and we ended up promoting this use of rice husk as on our subsequent programs. We also recently launched another program focusing on 4 key value chains. There's rice, there's soya bean, there's poultry, there's tomato. And the name of the program is HAPPY. I mean, the acronym is HAPPY, Harnessing Agricultural Prosperity and Productivity for youth. And on this program, one of the things that we are doing, which is very similar to some of the things that my previous speakers talked about, was working with the farmers to ensure that they are using climate resilient crop varieties. And so we are in constant discussions with CSR, I think it's Community for Scientific Research, who advises us on how to go about some of these things. And it's really working well on the program, and we are excited that there are a lot more learnings from what I've heard that we can also use on our programs. There's also that component that focuses on climate finance, where we work with young people, providing innovative financing to test new agricultural practices that are sort of adapt to climate change and things like that. And so these are areas that we are also testing on. So there's a lot that we are doing in this space, but we do recognize that there's still a lot to learn, which is why we appreciate being in such gatherings, learning from, of course, the experts as to what else we can do, where else should we be looking at, and who else can we bring on board as we co-create some of these solutions. One word that I heard that really got me excited, and it's a big word in our office, is integrated approach, which you touched on. And for us, all through and through, things that we do, we come together through an integrated approach to ensure that we are tackling all the other components to sort of move towards a systemic approach. At this point, I think I have done justice to the 7 minutes. You have. And I'm happy to answer questions. Thank you.
So thank you so much to our great panel, and I heard a lot of common themes, and I'm really excited about our discussion. I hope the organizers don't mind. I'm going to set aside the formal questions that I have written down, because I know we are past the original time, and I want to open the floor to our audience, because we do have an audience that looks quite youthful, and we have a lot of students, and I'd love to hear questions from the floor. And you had a chance to ask a question yesterday, so I'm going to open it first to... No, you didn't? You did. I'm hoping we can have someone who didn't have a chance to ask a question yet. Okay, you get to break the ice. Or maybe there's a Ghanaian phrase that would be more appropriate.
My name is Faustina Boachi. Don't be afraid. I'm not going to say anything that's not palatable to a lot of people. I'm sorry. But I'm so happy the last speaker touched on an area that cuts across all the agricultural and projects and research and all that have come up, because energy cuts across everything that has been said. Environment, energy are very, very, very important, because, for example, you are working on gender equity and all that. But if you help the women grow the crops, or the farmers grow very nice crops, good. It's supposed to help improve their health and nutrition, good. But the women will collect the crop residue, use it to cow dung, the animal, excess from the animal feed and all that, to use as fuel wood to process whatever crops that they have. For example, shea butter. You process shea butter using cow dung as your fuel. The outcome is black smoke entering the final product, makes it, nobody will purchase this. I worked with an organization where we helped improve, we provided water, and then we helped with the women process shea butter. But because they use bad fuel, the product came out with a lot of smoke. And People wouldn't buy it. People wouldn't buy it because of the product. So what I want to say is renewable energy is very, very important. That cuts across everything that you
Okay,
said.
thank you. So I don't know if our panel has any comments on that, or if we want to invite other questions. I didn't quite hear a question, but okay, any questions? Oh, I see one at the back. Yes, please, the young lady with the glasses. Great.
Okay, thank you so much for this opportunity. I came in late, and we have great minds here who are ready to change the narrative, and we are so grateful for this opportunity. Okay, so my question goes to the last speaker. Okay, he talked about so many initiatives to curb this canker going on. I want to ask, if you want to volunteer as a student, who do you go to? Since we don't have the resource to contribute, we can only contribute our strength and our time to change the narrative. So if you want to volunteer, who do you go to? Thank you so much.
No, thank you for that. Your name again?
Marijana.
Such a brilliant question. Thank you so much. Yes, so we have opportunities for internships on the programs that we do. Currently, even with the share industry partnership that we have partnered with the University of Development Studies, where young graduates, first year, second year, are allowed to have their internships on the program. But also our current partnerships that we currently have, we do give opportunities for internships yearly. And so I'll share with you the contact details as to who you should be reaching out to if you are interested in such an active service. Thank you.
Thank you very much. Other questions for our panelists? Oh, over here.
Hello, my name is Bubune. I'm from AgriSolve Limited. I would just like to address the fact that we understand all these interventions that have been put into engineering, farm inputs for grain production. I would just also like to add that the interventions for the social, the sensitization of these seeds and so on to the farmers should also be taken very seriously, because it's one thing to do the biology, the science, and then it's another thing to spread the word to these farmers. They already know how they farm. They've been doing that for years, for ages, and they tend to stick to their ways of production. So I think equally there should be interventions to spread the word. Okay, thanks.
So that's kind of a question, but I have some thoughts on that. Would you like to take a first crack at that? Do you have any comments?
Thank you for that good question. We have a number of interventions, and we work with farmers all the way. First, I did mention that before our students begin their PhD research, they go to farmers. Each PhD student will work with about 200 farmers, so they understand their problems before they go about developing their varieties. When we develop the varieties, we go back to the farmers. We hold something we call farmer field schools, where we coach them. We also do demonstration plots, where we show them what we have developed, so they make comparisons. If they find our varieties better than theirs, they are more likely to adopt. So we work with farmers all the way. We work with them.
Thank you, Professor Dankwa. And I think I would build on that farmers have a lot of knowledge, and they also deal with a lot of challenges and barriers that we professors and scientists sitting in our labs and in our offices may not even be aware of. And so doing the research with farmers alongside them and developing approaches that work under their conditions is really essential. And the IPCC report emphasized this strategy, but we've also heard it from many of our speakers today, not only in this session, but earlier, that co-learning together is really crucial. Otherwise, you may come up with either seeds or food products or livestock strategies or business strategies that are irrelevant or impossible for farmers to do. So I think really recognizing and respecting their knowledge and experience and the dramatic challenges they face, I think is really a starting point for effective adaptation research. Do we have more questions from the floor? Oh, goody. Yes, please.
Hi, everyone. My name is Denise Addo, and I must say this has been very insightful. I'd like to find out what are the ethical considerations. I've heard of certain genetically modified crops where I've heard they can, take certain genes from, let's say, a cow and then insert it into a rice plant. And I'm hearing it's quite helpful for people who are probably vegans, but what are the ethical considerations, since I've heard it's being adapted and used by Ghanaian farmers or researchers? Yes.
Panelists?
That is a question which comes up almost everywhere you speak. And people have vehement positions in that area. But the fact we know is that there is so much misinformation out there. What we have done in our work, you see, the subject that we do is called plant breeding. And the simplest meaning is man-directed evolution of crop plants. So you are a woman or man, you look at your needs and you design and develop the crops that meet your needs. So what do you need? You need, for example, a maize crop which is resistant against, for example, fall armyworm. It's a totally devastating disease. If you don't control it, it will totally destroy your crop. You are so young, so in 1983, maybe you were not in Ghana. In 1983, I was a student in this university. The university had been closed down, and to get a cup of rice for lunch or dinner in your home was a huge challenge. Or to get a cup of maize for lunch was a huge challenge, because all maize crops were destroyed by diseases, droughts, and pests. So assume you were a farmer and you've been given this resistant variety against, if you like, tolerant to drought, resistant to the fall armyworm. Will you take it? Will you ask where it is coming from? You see, young student, or are you a student? You just completed. You see how a variety has been developed is not a major issue. But what is in the variety that has been developed is the issue. So you call something substantial equivalence. Is this maize variety which was developed using top science the same as that variety which was developed using this kind of science? If it's yes, what is your problem? If it's no, then you have to interrogate further. So these are critical questions that oftentimes we walk farmers through. I remember a couple of years ago, we were summoned to the Council of State to walk them through GMOs. After the lecture, they said, look, bring the seeds, we'll grow. We'll send to farmers. I think it's training, coaching, information, knowledge. Knowledge is power. For lack of knowledge, we will perish. We will refuse to plant seeds which are great for us. And I think farmers are beginning to understand that for genetically modified crops, I believe you have traveled before. If you went to, for example, South Africa, and you took syrup, drink, perhaps what you took was GMO maize used to make that drink. We eat it everywhere. They are as good as, of course, about 1995-6, that the first varieties were released. There has not been a single case of unsafe crop. They are all safe. They are safe for us. Of course, so far as the evidence shows. They are safe, they are ethical, because of course, the varieties which are developed using good science go through serious regulatory processes. And when they pass, they are good for you. The processes are there for approving those varieties.
We have another question.
Yes, please. So, good evening to you all. My name is Nanaya Obian Samoa. I'm a proud alumni of Prempeh College 2019, and also a proud alumni of this school, University of Ghana, a fresh graduate 2023. So, looking at climate, we have this incidence that we are experiencing very high temperatures here in the tropic regions. Very, very high temperatures. There is so much heat here than usual. For the past month, I believe we can all bet to this that the heat here has become very high. And also, I've learned from the northern hemisphere or the temperate regions like Canada, United States, the winter becomes so great and the temperatures are so low. That is addressing the fact that the climate is actually changing and the ozone layer is also depleting gradually. So apart from planting so that we get to restore the ecosystem, what are some other ways we can do to preserve the ozone layer, whether by technology, apart from planting? What are some of the methods we can implement to preserve the ozone layer? Thank you very much.
Thank you for that question. You're right, it's no. I would agree with you, young sir, that it's unequivocal in terms of the science that climate change is happening, and it's due to anthropogenic sources, human sources of greenhouse gas emissions. That's a separate issue from the ozone layer, but in terms of what we can do, I mean, that's a complex question in a way. We need to push all of our governments to take action on climate change. I think coming from the north, we are more responsible for what's happening in the globe today. So pushing our government in the United States, pushing countries like Canada, the European Union to take much more serious action to reduce greenhouse gas emissions is critical. And really taking it seriously and pushing your government, what are you doing about climate change, not only in terms of adaptation, in terms of agriculture and food systems, but across the board? What's happening in our cities? We heard about housing earlier today. How are we planning for what we know is happening? What are we doing as a country? What are we doing as communities? What can I do as an individual in my community? How can I think about my own greenhouse gas emissions? Consumption, am I over-consuming meat? Am I one of those folks? Because that does contribute. What about use of car? Can I move to public transit? Can I use solar power? Those are at the individual level, but I think advocating our governments to take action and working in civil society to pressure our communities to really take action and plan for adaptation and for mitigation where possible, I think would be my answer to that. Maybe that's a good place to close. Oh, do we have any more? I need to see my organizer. one more over here. No? I don't want to get in trouble with the organizers. I think one more. Okay.
Yeah, I was just wondering. I think from Prof. Dankwa's presentation, I was wondering. I know that maize varieties produced by resistance varieties produced by Monsanto some time back had been used by our farmers. I thought now we have our own. So I was just wondering, when you gave the indication that we still do import, is that still happening?
Thank you, senior colleague. The simple answer is yes. A number of farmers use their own varieties. But for big farmers in this country and most commercial farms, they use imported hybrid maize. In fact, about 80% of hybrid maize seed used in this country is imported. And if you went to some of the commercial farms, when the weather is harsh, you'll be troubled, because most of those imported seed fail in the fields. That is why some of the hybrids that we have developed are the most resilient and sought after varieties. Nonetheless, opportunity to scale up the seed is low, isn't there? Because of the weak support, and if you went to the University of Ghana farms or other field stations in this country, you see that the facilities are so poor for scaling up. And because there is no incentive to support local innovation because of importation of seed and subsidies to, if you like, farmers, people will go for imported seed and make money out of the business. And so what we need to do is to, perhaps like Nigeria has done for rice, ban importation and support local innovation so that our seed will get to farmers.
I see a question, but I'm worried that we're beyond time. Where's there she is. I couldn't see you earlier. So I will ask you to ask our panelists. So can I just ask everyone to give a hand to our great panel here? And I will pass it over to the organizers. Thank you so much for a great discussion, everyone.
Thank you. A round of applause for them as they prepare to take their seats. Thank you very much. We want to thank our panelist and moderator very much for throwing light on the topic for the second panel discussion, which was transdisciplinary approaches, climate change and adaptation. And to all of us who made contributions to the discussions, asked questions, and made suggestions, we want to thank you so much. We want to thank our students. We thank you for participating. We are very proud of you. I believe that some of you are from the College of Education. Give me a wave if you are from the College of Education. Thank you very much. Do we have a Department of Political Science students here as well? Thank you so much. I want to recognize any other students here I have not mentioned. Please just give me a wave. Thank you for being here. We appreciate your coming. You were here as well yesterday at the Great Hall, and we are very happy to do that. Before we end, there's going to be a recognition of Cornell University Alumni Club. And I would like to call Professor Rachel Riddle to please come forward. We understand that you are going to be leading this. Okay. Provost? Okay. Okay. Then maybe you have to introduce yourself.
Thank you so much. Thank you so much to all of our panelists and our wonderful colleagues here at University of Ghana. On behalf of Cornell University, I would like to also welcome our provost, Mike Kotlikoff, back to the stage. And Vice Provost Wendy Wilford, Vice Provost for International Affairs.
Well, thank everyone for coming. This has been a wonderful session and a wonderful 2 days and just a tremendous introduction to the University of Ghana. It really has been a wonderful pleasure. Met so many colleagues and so impressed by our collaboration and what we've done together. Now I'd like to just recognize the Cornell Club of Ghana. And if you would come up here now, we'd like to take a picture together and so please, all of our alumni, all the Cornell alumni in the audience, come all up. How are you? Good. Hi, how are you? Hey, how are you? Hi, good to see you again. Hello. Thank you. Hey, how are you? Hi, how are you? Hi. How are you? How are you?
It's so wonderful to see so many Cornell alumni here in Ghana. The alumni in Ghana make us very proud, and we're thrilled by their accomplishments, but also by the connection that they maintain to Cornell University. They have hosted our students, they have sent our students off as well in send-off occasions, and they maintain a bridge between Cornell and Ghana. We're very pleased that the alumni are forming a formal alumni club, Alumni Club of Ghana, and we look forward to staying in touch and being able to coordinate connections here in Ghana with the University of Ghana and also with our alumni.
Thank you, everybody.
Oh, and
Oh, you're gonna tell people that, no, please, I just want to let them know. No, I'll do it.
So a round of applause for them as they descend the stairs. I hope that they've served as sources of inspiration for our students here who have dreams of applying to Cornell University. You have people to look up to, so please take note of that. As we bring this to an end, I just want to invite the Pro-Vice Chancellor with responsibility for academic and student affairs to deliver some remarks, some closing remarks before we end this evening's session.
Good evening to you all. So on behalf of the Vice Chancellor and the management of the university, I wish to sincerely thank our colleagues from Cornell University for this very kind visit. I think it has been a very productive few days. The leadership of the two institutions have gotten to know each other better, and all the units that are doing research and having collaborations with Cornell have had the opportunity to also engage the leadership of Cornell University. I think that the output from this meeting would be tangible and significant over the years to come. And we look forward to closer collaboration and deepening of the partnership between the two universities. So we thank you very much. Coming back home, I want to thank all the guests who have participated from outside the university. We appreciate your commitment of time and your resources that you put towards participating in these discussions over the last few days. So let's appreciate all the resource persons. Also, coming back to the University of Ghana, we need to appreciate our Office of International Programs, IPO, for all the coordination and the hard work in putting together the trip and organizing all the events and getting everything in place for this to be a successful trip. So IPO, thank you very much. We want to also thank our colleagues in our Public Affairs Directorate. They've been incredible trying to make sure that everything is well organized and the media have, good access to these rich discussions and live streaming, social media. This has been very effective in getting the message out. So we thank our Public Affairs. Finally, to our faculty, staff, and students who have made time to be part of these discussions. It is not common that students come to these meetings and stay to the end. Yeah, so kudos to you guys for, showing interest and engagement on these issues. After all, these issues are about you. They are about the future. And these are the issues that will shape your future. So I'm glad that you are taking interest and you are actively engaged. So we thank you very much for your participation. So it is my pleasure to now officially close this meeting between University of Ghana and Cornell. This is the University of Ghana, Ghana's hope and glory. This is Ghana's premier university. This is the best university in Ghana. Don't let anybody deceive you. As soon as you enter the campus, you know that you're in a world-class environment, right? So please, let's continue to represent the University of Ghana wherever we go. We stand for truth and integrity, and let's espouse those values. I thank you very much.
So would like to kindly invite our Cornell friends to please come up for a group photograph with the Pro Vice Chancellor and then we'll proceed for refreshments. Thank you. Thank you very much. We hope you've had a wonderful stay. We wish you all the best as you travel back home. We pray that you carry many beautiful memories from Ghana with you. And please do come back again soon. Thank you very much. An announcement, please. When we leave this place, we have some refreshments under the pagoda. Please, students, kindly note that follow the directions of the ushers when you go out. Please cooperate with them for refreshments. I'll kindly ask that we rise for the university anthem. Please rise. The words are on the back front inside cover, the back inside cover of the brochure. Thank you.
As we prepare to face the war in the mind.